In 2023, Treasury Secretary Ramadhan Gobi imposed a recruitment freeze on all government ministries, departments and agencies to allow the Auditor General carry out a payroll audit. However, on 19th February this year, the Permanent Secretary in the Ministry of Public Service, Catherine Bitarakwate, wrote to the Ministry of Health authorizing it to hire medical staff and fill out critical positions in the country's national and regional referral hospitals. At least 17 billion shillings was provided for this. However, the health sector is yet to carry out any recruitment in this regard, which has raised concern among Uganda Medical Association members. According to the association's president, Dr. Hebert Luswata, around 2,000 doctors are still languishing on the streets looking for jobs.
3 cohorts of interns who have finished internship, they have got their licenses from the council. But since this ban on recruitment was out, the government has not recruited. So today in Uganda, we have doctors who are unemployed. They are on the streets. An
additional 2,500 health workers have served in government health facilities and are now nearing retirement, having failed to secure promotions even when they have the required qualifications.
60% of these doctors are specialists, the gynecologists, obstetricians, the pediatricians, the surgeons, ENT surgeons, the psychiatrists, and they are ready to serve and to be promoted and do their work.
There is now fear among the health workers that Ugandans will continue to struggle with less than stellar quality health services if government health facilities continue to work with skeleton health staff.
We have a very huge human resource gap. There are some facilities which are really understaffed to the tune of only 20% positions occupied. When you look at hospitals like Moroto, Kayunga, Yumbe, there are very few health workers, and yet they are regional referral hospitals serving a very big population, more than 3 million people.
As such, the health workers have called for the immediate recruitment of health workers as directed by the Ministry of Public Service.
Let every facility send in their requirements in terms of human resource at all different cadres so that they are recruited. But in case that money remains, I want to ask Parliament that they should not take that money to Treasury and it's locked up. It should be just taken over the other financial year and we continue with the recruitment.
They have also called for the promotion of all health workers who are already serving in the system. But of critical importance to the association is also the introduction of an act to govern the internship and senior house officers' terms of service during internship in order to end the recurring strikes.
And all we request for, as they are making the internship act, let it be in line with the feedback the interns, the people who are going through this internship, gave them, not just them sitting in their offices and coming up with acts that will actually bring more strikes.
Joyce Nakato, NTV Weekend Edition.